Now here to something really serious. It's a terrible thing. It's a terrible thing to say, but we are facing another crisis out of all of this: mental health. The silent epidemic, a consequence of the coronavirus. The figures, sorry about this, are frightening. Suicide rates in Australia are forecast to rise by up to 50% due to the economic and social impacts of the virus. Deaths from suicide are tipped to outstrip deaths from the pandemic by as much as 4 to 1. At the moment, around 3,000 people a year take their own lives. So we're talking about a possible increase to around 4,500. This is this business about social distancing and lockdowns and whatever. No one comprehends the mental impact this is having on people. Youth suicides are forecast to make almost half of the increase. And the research points to a generational mental health crisis linked directly to this pandemic. We're then told how the looming mental health crisis could have a $5 billion impact on productivity, while also threatening the longer-term economic recovery. There is talk of a, quote, tsunami of newly unemployed. Andrew talked about that. And remember, close to 600,000 jobs were lost last month, and forecasts of the greatest decline in national wealth since the Great Depression. Early this month, the Brain and Mind Centre at Sydney University released what it described as unique modelling that demonstrated how many lives could be saved, particularly in rural and regional areas, by flattening what was described as the mental health curve. The modelling showed that with the right action, up to 53 suicide deaths, 669 suicide attempts, and more than 4,500 emergency department presentations could be prevented over 5 years in just one region of 530,000 people. We're told nationally that could translate to 2,600 lives saved, 33,450 fewer suicide attempts. That is with the right action, and almost 226,000 fewer emergency department presentations. I read recently an email from a listener of mine. I called him Bill. It wasn't his name. Bill said in part, and I quote, "I'm early 60s and suffer from major depression and generalised anxiety disorder. I didn't listen to my GP and psychiatrist, and I kept struggling on until I fell apart. I'm pretty well useless to anyone. I don't think many will miss me when I go. I push on only for my 93-year-old mother, whom I love with all my being, as I promised my dad I'd look after her. When she's gone, I can't come up with a reason to keep trudging on. My worst time of the day is the couple of hours before dawn, when I lie wishing I could push back the coming day and all the pain and sadness it will bring. Then you come on my radio and into my life. These are the hours I spend with you. I don't know what I'll do now, but I do wish you well, sir, and thank you for helping me, even though you didn't know me." Well, I wrote to Bill to tell him that we do care, and I heard back. He told me he's done as I suggested, linked up again with his doctors, and I think that Bill has been saved. But how many other Bills are there out there? In the context of all this, we're joined by Professor Adam Scott. He's a young fellow, the Director of Cardiac Sciences at the Royal Brisbane and Women's Hospital, a PhD in cardiac medicine. He's a Fellow of the Cardiac Society of Australia and New Zealand, the European Society of Cardiology, the American College of Cardiology, and Exercises and Sports Science Australia. He's been described, Adam Scott, as one of the founding fathers of modern telehealth. And in 2011, he founded the White Cloud Foundation. Now, their website is whitecloudfoundation.org. They describe themselves, quote, "a mental health not-for-profit organisation that provides early intervention services for Australians with or at risk of developing depression, post-traumatic stress disorder, or perinatal depression." In that latter capacity, they also run a service called Meals for Mums. They say it's the only one of its kind. Under it, nutritious, home-delivered meals are given to new or expectant mothers with or at risk of developing perinatal depression. Perinatal is the time during and after pregnancy. Professor Adam Scott joins us. This isn't entirely a good news story, needless to say. We'll find in the end what the attitude of government is to all of this. But Adam, thank you for your time and for your efforts in helping those doing it tough. How does a specialist in cardiac science get into the field of helping people who are battling mental illness?
Hi, Alan. Hi, Richo. Thank you very much for having me on the show. It's a great question. I came into healthcare to really try and make an impact into the lives of Australians, regardless of where they lived. And so What I did a number of years ago was looked at our rural area of Australia about how we provide cardiac investigations and realised the volumes are so low that the capability to provide full cardiology services is really difficult. And so what I wanted to be able to do was to take our technology and be able to remote control operate our equipment from the Royal Brisbane and Women's Hospital and operate that equipment in our rural facilities like Longreach, so that patients don't have to drive long distances to access healthcare, so they don't have to wait long periods. And so we implemented this program in 2016. And what we've seen over 3 years is patients in these rural areas of Queensland now don't wait 37 days on average to access a cardiac investigation. They get same-day access. They don't wait 36 days to get that report done. They wait 7 minutes.
Good on you. So coming from that, Adam,
when the average person thinks about post-traumatic stress disorder, they think about soldiers coming back from Afghanistan, but it's wider than that in the community, isn't it?
It is. And when we look at our rural areas of Australia, we're asking a lot of them. They are suffering from drought, bushfire, flooding, and now we're looking at pandemic. I don't know what else we're going to throw at these regions. We're seeing huge unemployment rates, and so any one of these alone is enough to cause post-traumatic stress in an individual. And so what we need to do is look at ways of how we can better support these rural areas and provide the healthcare they need when they need it at the right location with the right health professionals.
But you're not able to do that yet, as I understand. This telehealth, does that actively apply to mental health in the same way as you're applying it to cardiac issues?
So what we did was we learnt from our telecardiac investigations program, which we've been internationally recognised by the European Society of Cardiology. We've just received a notification that it will be published in June in the highest impact factor ranking medical journal in the world. We've translated that knowledge, and at the White Cloud Foundation, we've developed a telemental health solution where we use value-based healthcare to provide an integrated practice unit created by a psychologist, dietitian, social worker, exercise physiologist, to be able to take those specialty services that are found in the city and deliver them via digital platform to these rural and remote areas. So we call this telemedicine or telehealth. And so rather than fly these health professionals in and out, we're able to have them sitting in a metropolitan location, delivering the services into the home, the GP practice, or the health facility in that rural location. So they get the right help from the right team at the right time.
So they don't need an official mental health plan. They don't even need an official diagnosis. Does that help people in coming forward, that they don't need to sit down with others before they can come to you?
So what we're trying to do is we recognise the conventional health system that's in place across Australia works very, very well in our metropolitan major cities, but there are gaps in our regional and rural locations. And so we actively encourage our patients to seek out their GP support, but we also know there's a huge stigma involved in accessing that support in our rural areas. And so what we want to be able to do is change our model of care, but still deliver the same conventional high quality treatment to our rural locations. So if we can enable access for people to be able to access it at home by a self-referral, via a nurse referral, an allied health referral from their GPs, then any way that we can provide this support earlier, because this is a suicide prevention plan. This is basically trying to get the services much earlier when people have the speed wobbles so that suicide is never, ever contemplated. So it's about getting connected, comprehensive and quality care to these areas when they need it.
Graham,
but how do we break down the stigma? Because it seems to me that out there in the real world, it's still the case that a lot of people will say, if you say, oh, look, I had to see a psychiatrist, they all look at you and say, well, you're obviously crazy, you're a bit cuckoo. I don't know that we've gotten rid of that yet. I think our society's still got a lot of that in it.
And it's very true. We see we've got a lot of groups out there that are doing fantastic work in reducing this stigma and raising awareness in all of our communities, but it's not a one-size-fits-all approach. We know what works in the city won't work in the country, and what works in the country won't work in the city. And so what we need to do is put ourselves in the shoes of these people. So if we live in a metropolitan location, we can't think, oh, this is how they should deliver services. We at White Cloud Foundation went on a listening tour and we actively listened to our GPs in Longreach. We listened to families at Winton about what they want from their healthcare system. They're already au fait with telehealth. They get specialty access, but what they don't get is that access into that mental health network. And that's where what we've got to try and do is deliver that to them effectively and efficiently when we can.
Right. Now, this is Professor Adam Scott, who's unbelievable. You can see him, you listen to him, you can hear his passion and his scholarship. Let me just point out to you that in September last year, what he's talking about received an international award. It was voted the best technology at the European Society of Cardiology Congress. I mean, this telehealth, this business. Now, that's the good news. Let me tell you the bad news. So, Professor Scott has written to the Federal Department of Health because the number of people who use the service will depend on the amount of funding. This costs money to do it, even though it saves money in what he's doing. Now, here's where the rubber hits the road. Adam Scott, Professor Adam Scott, am I right in saying that you wrote to the Federal Health Minister, good man Greg Hunt, I'm sure he didn't even read the letter, some bureaucrat would have, and you received a reply that there's no money. Let me read part of the letter. Quote, this is to Professor Scott. You've heard what the plan is. Fantastic, isn't it? While I commend the work of the White Cloud Foundation, there is currently no open or ad hoc grant funding opportunities available within the mental health funding budget to support this initiative. So that's good news, Adam? I don't think so. So where do you go from here?
Well, basically, I think we need to change our articulation and vocabulary around this. So think of this. All of the viewers tonight in a major metropolitan location, what I want you to do is think about the person that you love most in this world, and you're worried about them, really worried that they're depressed or they're suffering from an acute mental health crisis now. So what do we all do? We get in the car and we drive to our GP because our GP is our first point of contact. Now, what you're going to do now is you're going to drive everybody 6.5 hours towards the middle of Australia, because this is what happens in the rural location. Now, once you've driven 6.5 hours with this person who's in crisis, you then drive into this little small rural facility, you drive up to the GP practice, and you hope you can get an appointment, because that's what you do in a metropolitan location. Now, our GPs out there are really agile, they're really flexible, they adopt new technology, and they're really focused on their patients. Now, the problem at the moment is that GP is so stretched and under-resourced that they see that patient briefly, they give some great advice and support them, but that's all they can do. There's no other allied health resources in town. There's nothing they can do. So what they do is they say, hey, there's an app you can download. I want you to drive home 6.5 hours now. Download that app and that website and have a look at ways that you can self-treat yourself with the condition that you've currently got. Now, I'm all for technology and completely agree that apps and websites are fantastic for certain populations in certain areas. But think of this, if you break your leg and you go to your GP or an emergency department, they don't tell you to download an app and go home and fix it yourself. We ask our rural areas of Australia to do this with their mental health crises. And enough's enough. We need to start thinking about this is not acceptable. Australia is all about the fair go. This is not fair. And we've got the solutions. We have the digital platforms, we have the technologies, and we have the evidence base to be able to deliver this healthcare safely within the guidelines to the areas that need it.
You are amazing. You are amazing. You Indeed. Are amazing. This is the White Cloud Foundation, and I quote what it says, a mental health not-for-profit organisation that provides early intervention services for Australians with or at risk of developing depression or post-traumatic stress disorder. And just a quick one before you go, Adam, just tell us about your Meals for Mums, which is your other major scheme.
Yeah, so this is a great program. We have social workers and doctors and nurses all over Queensland that are referring mothers who are living with or at risk of developing perinatal depression, and they refer them to us to be able to provide them with 20 frozen gourmet meals that the mother chooses to be able to support them in that time of need, because we know when a mother breaks, the whole family breaks. And so mothers are really important to us, and we recognise we have to be able to do what we can where we can to be able to support them. And so these meals enable them for milk production, for energy, rather than them sacrificing themselves and feeding all the family and they're the last person that gets fed. So we've seen a 650% increase in this quarter alone compared to last year, and it is due to complications and the impacts associated with COVID. So we're looking for support for our Meals for Mum program and looking at how we can help mothers further. But we invite the community to look at the White Cloud Foundation website and come on board with this journey with us. We are really focused and passionate about helping Australians because they are our family. Everybody in Australia deserves the same level of support, whether they live urban or rurally.
You are amazing. You are amazing. Yeah. And I've got to give credit to Billy Ross, who's watching us tonight. And Billy Ross was a wonderful hooker for rugby, Australian rugby hooker, lovely family. And Billy said to me, "You've got to meet this bloke, this Adam Scott. He's got something going for him." Has he ever? It's Professor Adam Scott, the founder of the White Cloud Foundation. The website, go to it, whitecloudfoundation.org. Adam, thanks for your time.